sedikit mengenai Ibu Frida. Beliau memperoleh bachelor degree mengenai bahasa Inggris dari, sebentar, ini saya bacanya susah. Dari universitas apa ya? Nggak kelihatan di sini. Kemudian melanjutkan masternya di Sanata Dharma dan pernah memperoleh beasiswa dari Fulbright Visiting Scholarship di Washington DC. Mungkin saya nggak akan berlama-lama, waktu dan tempat saya berikan kepada Frida. Terima kasih.
Ya, silakan. Sorry, Mbak
Frida
Frida.
masih di mute.
Sudah saya unmute ya. Silakan.
Oke. Terima kasih Pak Andreas sudah memperkenalkan. Selamat sore teman-teman. Sore ini kita akan berdiskusi dengan Dr. Su. Dr. Su ini seorang ahli di traditional Chinese medicine. Saya akan perkenalkan sedikit tentang beliau. Jadi Dr. Su ini memperoleh gelar di traditional Chinese medicine and Western medicine dari Tian Jin University of Traditional Chinese Medicine. Kemudian beliau melanjutkan pendidikan di Acupuncture College of Los Angeles, sehingga beliau memperoleh Diplomate of Oriental Medicine and Acupuncture Modern Research dari college tersebut. Kemudian untuk pengalaman kerja beliau pada mulai tahun 2001 hingga 2012, beliau ini sebagai dokter di Tian Jin Second Hospital of TCM University. Beliau melakukan penelitian khususnya di penyakit kardiovaskuler, stroke, metabolisme, dan penyakit kelainan metabolisme. Kemudian sejak tahun 2012 beliau di Jakarta, awalnya di Pausengtang TCM Healthcare Center. Kalau tadi saya google itu sekitar Kuwait. Beliau memberikan obatan pada penyakit menggunakan terapi tradisional Johnson. Akhir akupunktur, cupping, moxidation, acupressure, dan juga diet and Qi movement. Kemudian sejak tahun 2018 beliau menjabat sebagai Director and Senior Health Consultant in Clinic di Jakarta. Kemudian beliau juga merupakan Health and Wellness Center to patients combined with modern science and traditional Chinese medicine. Kemudian beliau juga memberikan pendidikan dan panduan bagi akupunktur lokal di Indonesia mengenai diagnosa dan pengobatan menggunakan tradisional. Nanti untuk pertanyaan silakan teman-teman mengetikkan dulu dalam bahasa Indonesia, boleh nanti saya pandu akan saya sampaikan pada sesi diskusi setelah Dr. Su mempresentasikan materinya. Nanti pada saatnya host Pak Daniel akan unmute mikrofon teman-teman jika ingin menyampaikan pertanyaan secara langsung pada Dr. Su nanti ya. Oke, Dr. Su, the floor is given to you.
Thank you. Thank you, Miss Frida. Yeah, thank you, Daniel.
Yes.
Okay. And okay. So actually, now the COVID is very aggressive in all of the world. I think the COVID, for how to prevent our health and how to prevent our family's health, how to keep away from infection. This is everybody's concern. Okay, what I speak can hear everybody?
Sure.
Yes.
Okay. Yeah. Okay. Actually, I'm quite young doctor in this area, and thank you for this opportunity, Daniel, Frida, Andreas, and
yes.
then also Hendrik, to give me the chance to share some of my thoughts on coronavirus, pneumonia. If there's something wrong, please correct me, yeah, everybody.
Yeah.
Okay, and so I think everybody should know what's the TCM, right? Traditional Chinese medicine. Yeah, this traditional Chinese medicine, I think is not strange for everybody, because from our since we are young, our ancestors and parents already give us some Chinese medicines already inject to our life, and like some also impact our growth. For example, when the child just grow up like 7, 8, 9 years old, normally our parents will give us some chicken soup. In the chicken soup, we'll put some like a Tian Jin, hanjiao, goji. But that one sometimes the taste not nice, but good for our growing, right? And when a woman after keep production, some of their parents or grandparents cooked the sesame oil, ginger, chicken, wine. My wife used to drink that. The taste not very nice, but my mom said it's good for after give birth, lose a lot of blood and also energy. You drink that can boost when you're getting aged. You will not happen to the other sickness. We never know, but we just follow. Yeah, and also like Indonesian, very popular. They call crock, right? When our body just catch the cold, like a masuk angin. So the people use the coins to scrub, to rub the body. I think this is also the Chinese way, Chinese traditional therapy. But if we ask our parents or grandparents why they happen like that, why you ask me to drink like this or eat that, sometimes they cannot speak clear, but we just followed by many generations. Okay, so this all showing the Chinese medicine actually is typical clinical medicine, which is originate from China. And also it's all generate from our life and service our lives. Already 5,000 years, this extents must have their certain reason. Yeah. So comparison modern science. Yeah. So what's the difference between the Western medicine and traditional Chinese medicine? The theory of Western medicine and Chinese medicine is different. Let's make it simple. The treatment of Western medicine is to their target is to disease itself. But for Chinese traditional medicine, we don't care. Well, or we can say we don't care that much about disease, but we care about the people who got disease. Yeah, I think that's okay. I have my file here. Okay, and a change in other words. As long as Western medicine is aware of the nature of disease, then the doctor apply the chemical drug or perform the surgery to help patient. As for the different doctor, the treatment methods are basically similar. But for Chinese traditional medicine, the same disease for different people, the therapy and the medication could be different. However, if different people got different disease, but after our TCM doctor diagnosis, found out the basic cause is same, probably the medication and the therapy will be same for those different patients. Sounds interesting, right? But which is mean in TCM? It's called dialectic treatment. Okay. All right, so it must be next page. Okay, so for Western medicine, they treat also the symptoms. For example, headache. Basically, if a patient complains about headache, the doctor will usually give some paracetamol, like a Panadol, or the other painkiller. No matter it's because of these headaches, because of like a hypertension or the neck vertebrae problem or the other sickness to cause the headache. Because headache only a symptoms, right? Anyway, just give some painkiller to suppress the symptoms. But if the headache patients come to visit TCM doctor, we will check the patient's tongue, pulse, and then, okay, we can analyze, or this is because of acid, it's because of weak, because wind, or because fire, because we have a special system to diagnose. Anyway, it's a different condition, we give different medication or different therapy. This is called dialectic individual treatment, right? And let's say, what's the cause? Etiology. Yeah. So this what's the definition of etiology? This definition is the cause or the set of causes or manner of causation of a disease or condition. This is called etiology. But let's say specifically for COVID-19. In my point of view, they have classified two type of reason or factor to cause this COVID-19. Let's say first about external factor. The external factor, which is like the COVID-19 was outbreak in Wuhan. As far the people know, Wuhan is located in the eastern part of a Jianghan Plain, the middle reaches of a Changjiang River. Yeah, it's below the Changjiang. There are many rivers and lakes, so the water is very full, right, rich. But since December 2019, the Wuhan has been in a warm winter climate. We can see the climate record. The abnormal temperature. So in China, we also have 24 of solstice. So in that December supposed to be fall, in the winter solstice, supposed to be very cold, but the weather is hot. The weather is hot. So the haze of cold rain has been lingering for 3 months. Always rain, always rain. So the humidity is very heavy. The people feel very, uncomfortable. And the study found the most patients with a large tongue, if we study the tongue become larger, and also happen the tooth marks, the thick moss, the tongue coating on the tongue. All of these one signs show the characteristics of wet, which means we can understand as sputum. So Chinese medicine will diagnose it as white evil. We call the bad thing is like evil, yeah, disease. So this type of abnormal climate produce type of a plague, which is called epidemic pathogenic factor. So therefore, the root cause of this new outbreak of corona or coronary pneumonia is the word to earth gas, which means I call this epidemic pathogen. It's attached to the human, coupled with onset season and the Wuhan geography characterized of wet evil, from which Chinese traditional medicine believe that this disease can be described as wet epidemic. Wet epidemic. A lot of wet, if not get rid of from our body, so many causes can cause the fungus, just same as our rain season. For example, we just experienced the flood, Banjir in Jakarta. If the water long time stay, so our body feel uncomfortable. In the meantime, if our furniture, you can see our wall, our wood furniture, our board, we get fungus. Because what? Because wet. The wet, if it stay longer, they can cause the fungus, cause some of the other, the poisons things come out. So same as our body, if we accumulate a lot of humid or wet or this type of sputum, invisible sputum for a long time, so our body also can cause this type of poison or fungus inside. Right? Okay, so this is what we call the external factor. Now let's talk in the internal factor. Internal factor in TCM point of view probably is more a little bit complicated, because I will say from yin and yang and 5 element theory. Yeah. So analyze from the perspective of yin yang and 5 element theory, the spleen, our digestion, like spleen is belong to soil. Soil, if soil weakness lead to liver and wood excess. The wood, which means the liver, is called wood. So in the forming a liver strong but spleen weak pattern in this type of relationship, supposed to be very balanced, spleen and liver. But if spleen is quite weak, the liver is going very strong to attack spleen. Yeah. So spleen cannot transport water well, so that the body generate excess wet, turbid. So turbid, like a little bit slime, not clear or blurred, this type of things. Yeah. So many patients can see the tongue coating and also feel fatigue, tired, and burnout or bloating stomach, or poop a little bit nauseous or sticky, and sometimes you can vomit, and the other digestion system symptoms. So that is called spleen wet. Yeah. So if the liver got strong, also can showing the fever, soreness, the sore throat, and the eyes dry, and the other wind, and it's easy to get angry, a little bit emotion. Yeah, this called disturbance symptoms. This belong to the liver part. And another very important factor is our body, this positive guard, which means our energy, this type of immunity, not strong, insufficient. So the defense ability is reduced. So that this type of epidemic pathogen invade our body and then to make us sick. Yeah. So another thing is the treatment, yeah, in TCM. Now the TCM treatment is very surprising in the world, but still cannot easy to accept by the other, like European or the American people. And even Indonesian, I noticed still not many people accept, especially herb. The herb, the taste and smell. That's why maybe you guys heard the China sent our medical team to Italy. They give them the herbs, because in China, we applied the herbs and also Western medicine together for those patients. But you see the success rate or anyway, the result is very satisfied. But if we put this set of herbs or TCM therapy to copy and then to the Italy, most people cannot accept. Maybe they are too ego, or maybe they really don't like the taste of herbs. That's why, okay, this is how our TCM team just come back China. Yeah, and okay, let's go back. Yeah, let's come back to say the treatment in TCM. The traditional Chinese medicines, understanding the pathogens and not only attach importance the internal factors, but also our positive, also our climate environmental factors. But our goal is to mobilize the body in yang and then defense this ability. Yeah, and we can see in the fight against the SARS in 2003, the intervention of TCM therapy has played an important role in reducing the number of days of fever, reducing symptoms of ventilator, reducing the amount of glucocorticoid and side effects, reducing the sequelae, and improving the cure rate, which has been affirmed by WHO. And also another treatment, dialectical prescription. For those severe patients, we not give this the ordinary herbs. We just give them some specific treatment or herbs according to their town and their pulse. And so this is called dialectical prescription, especially for those severe patients. Yeah, so this page will pass. Sorry. And most line into the initial, medium. So, okay, we classify the COVID patients have 4 stages. One stage from minimum, from below is like initial, medium, a critical period, and recovery period, and 4 stage. For different periods of disease, the corresponding treatment different. Yeah. Must be next page. Yeah, another next page. Let's say the advantage of TCM. Okay, very well. Okay. In the modern medicine, it's difficult to find drugs that are targeted or effective for COVID-19 or have the lag. The time always cannot catch about the sickness. But TCM emphasized the overall view and dialectical treatment. Before identifying the pathogen, the use of a basic principle of, this is not supporting the evil, is expel the evil. Under the guidance of dialectical theory, and TCM doctor will make the corresponding prescription according to the clinical manifestation of disease, and to improve the body ability to fight disease, which is obvious theoretical advantage of the traditional Chinese medicine. And another advantage of TCM we call the experience advantage. Yeah, the traditional Chinese medicine has a long history from more than 2,000 years ago. Let's see the book, the Yellow Emperor's Inner Book, and to the Han Dynasty, we have Zhang Zhongjing, have a typhoid disease theory. But until Ming and Qing Dynasty, there used to be, let's say 500, 600 years ago, there used to be the rise of some epidemic disease. But in that time, we don't know what is that. We just call it plague. But from that moment, our doctors start to make a lot of detailed prescription, also description of this pathogen and infection disease. Actually, this is our early description of plague. Also, in the prevention of treatment of infectious diseases, Chinese medicine has accumulated a wealth of experience and a large amount of effective prescription. So in the past infection disease, such like we call the B type of encephalitis, SARS, hand, feet, mouth disease, Singapore flu, H1N1, and dengue fever, and other aspects of a prevention and treatment process has played a huge role. So this is what we call experience advantage. Yeah. Another one is drug advantage. For Western medicine, in the process of pathogenic microorganisms, and it's often limited to a certain point. Pharmacological effect is single and prone to drug resistance and obvious adverse reaction, which means side effect. Like you guys must have heard like this Lopinavir, Ritonavir. So they are obviously seems like work not very satisfying, and it can cause the patient got like gastrointestinal disorder and other side effects, feel unwell. Okay, another advantage like the drug, advantage. So Chinese medicine is to pay attention to the combination. Combination means even single Chinese medicine is multi-component combination. With multi-component, multiple target natural advantages. Modern pharmacological research show that some Chinese medicine, such like silver flowers, also has a clear anti-pathogenic microorganism. The use of this Chinese medicine in Chinese medicine prescription combined with Western medicine, so can not only produce synergies, but also reduce the resistance and adverse reaction of Western medicine. I remember 200 years ago, in the Qing Dynasty, there's a very famous book. So this book, especially to introduce the Western medicine together with Chinese medicine, can cure many type of disease. If people you have interest to read, I can show you the name. Okay, let's talk about how to prevent this COVID-19 now. Okay. So the risky assessment relates primarily on individual declaring symptoms. Okay, for example, if you got some symptoms, you just declare by yourself to the doctor or the other medical workers. Like if you call fever, sore throat, you have to report. And also investigating travel history, you must report honestly where you have been, and the exposure history or your someone your contact or closer contact. So in China, so far actually all the world think China's do very well job, right, to prevent people away from this infection. You know why? Because our investigator, like a social worker or the other medical worker, they're very strict. When they see someone, so first of all, they will ask some question, 3 questions, but this question is very interesting, but also it's a very philosophical triple soul torture, which means like, who are you? Where are you from? Where are you going? Yeah. Okay, so those at high risk were screened for nucleic acid and central isolate for 14 days. And close contacts with these high-risk persons were also observed in 14 days of medical isolation. So the isolation is not lifted until both nucleic acid tests are negative after 14 days. Okay, the self-prevention. This virus transmission, they have a the transmission of virus have a 3 type of a rule to transmission to our people. One is direct, which means refer to patients sneezing, coughing, talking, the droplet and exhale gas, direct inhaled caused by infection. Another one is very deadly, which means aerosol propagation. To refer to the droplet mixed in the air, forming aerosols. Inhalation leads to infection. The number 3 is contact transmission. Refers to the droplets deposited on the surface of object, like our door knob, and our table, handphone, this one. Contact with the contaminated hand, and then contact with the mouth, nasal cavity, eyes, and the other mucous membrane, resulting infection. Finally, I want to say again, TCM treatment is actually a treatment of people, just yin and yang and balanced of a sick person, not blindly to remove the disease or blindly increase the body positive spirit, means like immunity, but just let patients their own yin yang tends to balance, so that can stimulate our body ability to self-healing. The health is not absolute, but it's relative and always in the move. Yeah. So if we want to maintain the healthy state, we must take care of the yin-yang balance to make our living regular. Our
Sorry. Aduh. Sorry. Oke, ya. Unmute. Dr. Su.
Yeah, hello.
Okay,
Daniel.
yeah. Apologize for accidentally unmute your microphone.
Oh, that's okay.
Yeah.
Interesting. Okay.
Have you finished?
Yeah, I'm finished. I'm just waiting for people. So I gave some question.
Oh, oke. Okay.
Yeah.
Mbak Frida, oke, saya unmute dulu, sorry. Oke. Sorry, ini. Oke. Ya, silakan.
Okay. Thank you, Dr. Su, for
Thank you, Frida.
very open-minded presentation from you. There are some questions from the, how do you call it, the participants. Maybe some of them are in English and you can realize them directly.
Yeah.
But
okay.
I will read the ones in Indonesian first. Is it okay, Dr. Su?
Yeah, please.
Okay. The first question is, there is a traditional medicine from Indonesia that is called ginger.
Ginger.
Yeah, is it possible to increase the body immunity, considering that ginger is also having the characteristic of being hot?
Yeah. I also read this remedy. Even I see the video from President Jokowi. He used to drink like ginger and the mulawat and gunit, and another one. What is it? I forget. So I think in these three medicine, the termite, the gunit and the mulawat, this is good for our liver. This can clean our liver, especially when we suffer from like fatty liver and or cirrhosis, or you feel like the hypertension patients. Anyway, got the liver problem. Usually we drink the mulawat and the gunit. They also record in our TCM, the medicines book. For ginger, it's not, not benefit to our liver. So ginger's, the meridian is to our bladder's meridian. Bladder meridian and also our stomach meridian. So this ginger can help us to sweat because it's a little bit spice. Make us spice make us the sweat and the hot in the body. But in this meantime, they can also to stimulate our ability to guard from the wind and cold. Yeah, that's why if someone got like a little bit the wind and cold, we drink some ginger. Indonesia also have a ginger like a production we call sari jahe, if I didn't remember wrong incorrectly. Yeah, I mean this type of a drink is good for our body to dispense all of this cold and wind, but not especially for this type of virus, COVID-19. This COVID-19 is from our China observation that after the patients pass away, we do autonomy of their body. We cut the lung to have a look. There are a lot of mucus, slime, or sputum in their lung. So this type of thing to block our lung to breathe cannot inflate or contract, inflate, cannot. That's why the people in the last stage is very hard to breathe. But in this time, if the doctor give high flow of oxygen, supposed to be good, but the patient cannot breathe. The same as the lung, the same as patients in the water, deep water, you cannot breathe. So, but in this case, the jahe or the other two ingredients doesn't work at all. That's why we had to get rid of all of this mucus from our body. That's why I say it's wet. Okay.
That's the first question, yeah. Okay, now let's move on. Do you want me to read all questions? I mean, like 3 questions and then you answer, or just one by one and then you answer?
That's okay. One by one is fine.
Okay, all right. So there is a question here. You did not mention about lung, only mention about liver and spleen. Does it mean that the prevention of COVID-19 from TCM point of view is to strengthen our liver and spleen? How to do it in a day-to-day basis?
Oh yes, that's a good question. Actually, the COVID-19 infected our lung, right? So our organ, only the lung you can see the things there. But behind the lung, it's all because of a spleen and the liver's not strong or not regulate, this balance not very well. The spleen cannot metabolize our water very well. That's why it can generate excess sweat. But this also the liver cannot make it gone. So our body and TCM, from a TCM theory, our body like spleen, our spleen we eat all of nutrition including the nutrition, also including the water. So we're going lift up from our left side and go to our lung to spread all of the nutrition to our body. And after that, our liver, this waste going down. Our liver's job is to make all of this waste left from our body. But in these cases, it's like this, the small circle moving. But if the COVID infect us, if our body immune strong, it's fine. But why the COVID invade us? They invade to our lower respiratory, not upper. If upper, I think all of us used to experience like sore throat, sneezing, and a little bit cough, yeah, and the itchiness. This is our up. But the COVID, this coronavirus, directly go to our down, our lung, the down part. So this is their very special part, a special character. So if we increase our spleens and strengthen our strengthen our liver function, this excess mucus will be gone. So you can see the femurs prescription in the China TCM prescription. There's some medicine to dispense to make it this COVID, this virus go out from our breath. And most of herbs or ingredients is to strengthen or to get rid of this wet or mucus or humid out from our body. And also some medicine ingredients is to strengthen our our liver. We not focus much on the lung. So this is interesting. But of course, if we strengthen the lung, of course, also benefit. It depends on what way you want to strengthen our lung, make our lungs more healthy. Yeah. How about another question?
The next question is there is a news from the China government that providing swallow nest soup is recommended to recover the body after the outbreak. Is it possible to explain that swallow nest soup is part of traditional Chinese medicine?
You mean the bird nest? In Indonesian called sarang borong. Sarang borong. Oh yeah. Sarang borong. Sarang borong.
Sarang burung.
Yeah. Okay, sarang borong. Okay. Sarang borong. Sarang borong is good for our lung. Yeah, this is for sure. And but still, some doctors keep their own comment for that. They just call this only from saliva's protein. But for Chinese TCM, we use the bird nest already more than 1,000 years. So this one, the bird nest, from our drug, our traditional medicines book, is good to nourish our lung and kidney. Yeah. But if we already have excess phlegm or sputum from in our lung, it's not suitable to drink this type of bird nest. They will make ours this flame will be worse. It generate more. But if our stage just stay like dry cough, okay, sarang borong very well. I agree. Also add another ingredients like anzao, red date, and goji, on the other like maidong. They also nourish our lung and also can very benefit to our bronchitis, just the early stage. But if already happened, many sputum and also flame, better don't eat. They will make us worse. This is bird nest.
The next question is, will reishi or astragalus Huangqi helps improving body immune to face COVID-19?
You mean Huangqi, right? Tianqi, Huangqi. Sorry, this name is
yeah.
Sorry. Oh yeah.
Astragalus or Huangqi,
Yeah. Huangqi is very well. Huangqi not just to boost our immune, but in the meantime, they can also help us to get rid of the excess water. So Huangqi is the best, actually. From now on, I advise all of the people drink Huangqi. But Tianqi is for our blood mostly. Like a very, very famous medicine name is Yunnan Baiyao. So this is in the Yunnan Baiyao, the ingredients is the Tianqi. That can help us help the blood move faster and also get rid of our water, the trash in our blood vessel. Also, Tianqi is super good for the coronary artery disease, like heart or fatty liver. Anyway, it can help us to get rid of the fat. But for coronavirus, Tianqi, I don't think it's working that much. But Huangqi definitely have.
Next question. Okay, so what do you think about the report of forensic autopsy from the team of Professor Liu Liang from Tongji Medical College? Are you familiar with it?
Sorry.
Yeah, so what do you think?
Say again.
Yeah.
Sorry.
The report of forensic autopsy from Professor Liu Liang from Dongji Medical College.
东直门 ，OK，
Dongji.
Dongzhimen Hospital, right? 明治 Huangji Health Improvement. Sorry, let me see the chat there. Which one? Okay. Oh, Dongzhimen. Okay. So this one, bagaimana ya? Bagaimana dokter tentang hasil report automatics? Oh yeah. Okay. You mean that I don't know which one you means this autopsy result. It's a lot of mucus. That one, just moment I mentioned or not? Chen Indrawati.
Oke, saya unmute ya. Oke.
Ya.
Ya, silakan Ibu Chen Indrawati.
Ya, halo.
Halo, ya, halo Pak.
Sorry.
Ya, halo. Jadi kami membaca, halo.
Ya.
Yes, okay.
Kami membaca report dari Profesor Liu Liang di Tongji Medical College tentang forensik. Dia mengatakan demikian bahwa sebetulnya pada waktu COVID ini itu yang tersumbat adalah saluran napasnya. Jadi bronchus, bronchiolus, alveolus. Sehingga kalau itu nanti ditekan oleh ventilator, dia itu justru bukan memperbaiki, tetapi justru memampatkan mukus yang lengket, kental dan lengket. Sehingga di Tiongkok itu ada obat tradisional Chinese medicine yang mengencelkan dan mengurangi kemukusan daripada kekentalan dan mengabsorpsi daripada phlegm tadi, dahak tadi. Dan ini juga kalau saya hubungkan dengan metode ECMO, extracorporeal itu membran operation, itu kan juga metodenya adalah dia menguras paru-paru. Jadi memang hampir logikanya sama, yaitu di dalam salurannya itu banyak sekali lendir, mukus. Sehingga bagaimana pendapat Dr. Su tentang apakah ada obat yang mengencerkan atau mengabsorpsi itu sehingga mengurangi sumbatan bronkus dan lain-lain terhadap mukus tadi itu. Kalau ada obat Chinese-nya itu apa? TCM-nya apa? Terima kasih.
Thank you, Pak Chen. Sorry, I think I need translator.
It's a long explanation.
Okay, long explanation. Okay.
恐怕我解释给你。
哎，好的，谢谢。
那个肺部那个最小的肺部管啊，那个有很多 flame，
Yes，
就是那个如果用 ventilator 那个很重的病人，他会 blockage 那个肺部最小的管啊。
Yes，
所以那个博士啊，给我们解释那个有中国的中药给那个flame， 点在那里面呢 dilute the flame， 所以那个 flame 已经没有了，那个肺部就正常了，所以那个 ventilator 给病重很重的人就不能够用，那个很像那个 ECMO 那个开刀的，好像是一样的 similar basic principle。
Yes,
谢谢，
right.
谢谢。
Yeah, actually, for the last stage, if some patient already used the open ventilator or the ECMO, the life rate is not very high. And if they already saved the life from the COVID-19, but definitely they will die or from another infection like a bacterial infection in the lung. Anyway, for that's just a moment I already explained this. in the COVID, the last stage, if do autopsy from the in the lung, you have two part of a change. One is a lot of mucus, just like seems like we put the lung into the water, so the lung cannot inflate, cannot breathe, because a lot of mucus, lot of sputum there to block the lung break. This is one. Number two, this COVID, this coronavirus, they also slowly make the lung, the macrobronch, the bronchi, the fibrosis. So which means already getting, supposed to be very soft, can breathe, inflate, contract, inflate. But after COVID virus infected, so this type of thing, even the one getting hard, they cannot move. If cannot move, cannot get the oxygen. So no matter how strong oxygen flow you inject to the lung, but the patient still cannot use. So that's why in the final stage, the patients die from lack of oxygen. The same like you drown in the water, like this.
Thank you.
所以你的 advice 那个中药是什么名字，或者有什么中药？
Actually, there are a lot of medicine, Chinese herbs can get rid of flame. So don't make the lung generate a lot of flame. So if not many flame, not much flame, not lot of sputum, still can have the chance to save the life. But if you generate a lot, even the doctor already used very high dosage hormone like glucocorticoid, still cannot help.
Glucocorticoid.
Yes, still cannot reduce that much. But if happen, lucky, fortunately saved the life back, but the patient also got a lot of side effect from high dosage of medicine. Just same as SARS. Same as.
So what is your drug of choice of TCM?
Okay, regarding to this, later I will tell everybody what is my prescription for this.
Okay, thank you.
Okay, okay. Another question.
Yeah. Next, Mbak Frida. Mbak Frida. Hello.
Okay, there's question. Question from me. What kind of activity and or herbal supplement we can take to help us promoting our body defense to COVID-19? Okay, this I will, after this, later I will give patients my prescription, also combined with China famous one, 清肺排毒汤. Together, I'll tell friends, yeah, all of this. Okay, it's difficult to get fresh the mulawat and gunit here. It's using dry, the powder, the mulawat, the gunit works well too. Oh yeah, okay, fine. Still okay. Still can use the dry one or powder one or production. Doesn't matter. I mean, it's better than none. Yeah, pathogenes herpes seperti apa itu? This from Maitri Corona. Yeah. Seperti apa? Just how to say? Just generate a lot of slime, mucus slime, like jelly. Sorry, like jelly. There's a lot of jelly in our lung, right? This is all the jelly in the lung. The pathogens like how to explain? They're just this type of pathogen. It's virus. Not also is very tricky. This one can easy to change to the other type. That I so far already have more than 20 type of a subtype of this type this coronavirus. Not like the first outbreak in Wuhan. There's some subtype, the new type of virus, also very high, have strong infection power, or someone it can directly cause sick. This type of virus is very tricky and also change very fast. There's many rumors that this is not generate, it's not from our nature. This come out from the lab. Okay, and
Dr. Su, there is a question.
yeah, hello.
Yeah, so you know there is a suggestion to gargle with warm water and salt, and then is it helping? And what kind of body condition that helps us prevent the virus to duplicate in our body?
Or like use the salt water, wash mouth. And this one working can prevent to keep our health, not just for this type of virus, but also to all type of virus, like flu, the rash virus, the measles virus. They're also working because the salt can kill the germs. If you after our daily activity, we use salt water to wash our mouth, or use salt water to wash our nose cavity, nasal cavity, they're also very working. Twice a day, 3 times a day, yeah, just to maintain. But now we are quarantined at home, right? We don't not always go outside to, in contact with outdoor and not many outdoor activity. So I stay at home. We can do it twice a day, 3 times a day. But most important is to make our life regular, right? Don't break our timetable, our routine, and our food must be light. And if we can have some, don't eat much of a spicy, keep the healthy lifestyle, only that. And from TCM, we call make our yang strong, yin and yang, right? Make our yang strong. So we are not generate a lot of mucus or wet. If we have wet, we can also make it gone. Right? Just if like a rain season, the flood, a lot of rain, but if our sun very hot, very quick to evaporate the water, we not generate the bad.
There is another question here. So we can consume temulawak to boost our liver performance.
Okay, temulawak. Yes, that's good. I agree. Sometimes I also drink this fresh one or the dry one.
Okay. There is a question here. Is the traditional Chinese medicine can be applied along with the Western medicine in the procedure to handle COVID in all hospitals in China? And is it okay and approved by the WHO?
Yeah, since SARS in 2003, WHO gave a very high price to the TCM. The Chinese medicine combined together with Western medicine. So in Guangzhou, like a famous professor, Zhong Nanshan, in that hospital, in his hospital, they use the Chinese herbs together with Western medicine. So all the hospital, nobody died. And also the healthy discharge rate also very high. Also very rare to get the side effect after the discharge from hospital. This SARS, but this time we also in a hospital in Wuhan. Many of hospital especially use the Chinese traditional medicine, but not just herbs, but also together with acupuncture, massage, and moxa, and qigong. Anyway, just all including the whole set. So all the patients got the positive feedback.
Okay. And then there is a question related to the acupuncture. Which point is used? Which meridians are strengthened and weakened?
Oh yeah, there's no common or no ordinary point. We also if for some maintain the health, the point, how about later after this, I'll give our friends all of these points in acupuncture points, so we can do moxa and also point acupressure every day. We can give to our friends and also our family, and together with the herbs, my prescription, so we can share with people.
And the next question is, can we use Tian Jin?
片子黄?
Yeah, to fight this virus.
No, 片子黄 not for virus. Even for the bacterial, no problem. After operation, after the internal injury, use 片子黄 is good. But for this coronavirus, no. But we can use the you can use what, the 安宫牛黄丸. That one also good for our flame, our sputum, and also can clean our heat.
Okay, and then the next question is, what is suggested to consume at this time to make us stronger against the virus?
You mean the food?
The food, how do you call it? The
drink, medicine.
Drink.
I think many people already long time consume vitamin C, multiple vitamin B, vitamin E. It's all working good. Also, very easy to get, and also the taste or smell not so strong. But for the food, more vegetable, more fruit. Make sure our water drink 2 to 3 liters a day, and sleep quality well, and have some simple exercise every day, 30 minutes. The food, don't be so oily, don't be so greasy, don't be so salty, spicy. Yeah. If for the daily care, maybe just like that. But if you want to get some herbs, what will be best? Like some like herbal tea, like drink this damulawat, uni, jahe. I think just that. Also, the best way is not always go out. The quarantine at home. That's all. If some people send the food, like Gojek or someone, we have to be careful to disinfect it, to sterile.
There are some questions that I need to. You mentioned about the herbs that can improve the lung function, right? Would you please mention again? And also, what is Huang Qi? Can we get it in Indonesia?
Huang Qi is very easy to get from every the herbal shop, but for the lung, there are also many, not specific herbs, especially boost the lung, but to regulate our body yin and yang, and through this way we can make all of our organs strong, not just lung. If you boost the lung, but the other organ weak, still useless. Must be together up. Together boost.
And then there is the question, what is your comment about COVID-19 manifestation outside lung? Some case in Indonesia reports skin and eye symptoms.
Sorry, say again. Which one?
So in Indonesia, there are some cases that the symptoms are seen on the skin and eye. Yeah, what's your
on the skin and the eye?
Yes.
Yeah. So this virus also can be contaminated from our membrane, like eyes, nose, mouth. That's why you see all the doctor wear the eye, the glasses to prevent, right? Skin is all skin. If you contact with the sick person, I mean the positive people on your skin, you have to immediately wash your hands with flow 15 seconds to 20 seconds with sanitizer, with alcohol. This one can achieve the goal to prevent.
Is it good to do body steam or breath steam?
Excuse me?
Is it good to do body steam or breath steam? Which one that you recommend?
Body steam like spam, you mean?
To body steam or breath steam. Okay.
Breathe.
Yeah, person they use some oil, right? Aromatherapy, some like essential oil. Even Indonesian use what you call minyak gosok or minyak putih. There are a lot type of oil. Also, body steam also fine. It's good. All type of things to maintain our health we can use, but just lack of outside. If we already happen to some symptoms, like early symptom like sore throat, a little bit fatigue, the body heavy, which means there's wet and humid stay in our body. If we happen like that, this type of symptom we have to be aware of. Must be the excess wet in our body. We have to use some exercise to boost our yang. If yang strong, all the wet and humid can be gone.
So is it also recommended to like if you boil the water and then there is a steam?
Oh yeah, okay. Yeah. Yes. Okay. Yeah, but use the steam. We inhale, right? Inhale also use the steam can make our face more clean. It's okay.
All right, and then
this is advised.
Okay. The next question is: does COVID infect through both airborne and droplets? And then what kind of therapy that doctor could give to COVID patients in the hospital?
Oh yeah, in this one, yeah, the COVID, most of people got infected. It's just from the airborne and the droplet, because they move outside and they inhale some of the contagious air. They also got it. So most of people, like in Europe, in the US, they infected by this way. Yeah, that's what. Also, if this droplet and also airborne can stay sticky on our clothes, our hair, our eyebrows, many. That's why after we go out, have a daily active, come back, better we wash, then we take shower. And if we go to the crowded place, better we wear the N95 mask, not the simple surgical mask. That one too light, yeah. And what is it called? What type of therapy does doctor give to COVID patient in the hospital? Okay, it all depends on the symptoms. Depend on the symptoms. If patient got fever, okay, we just give the medicine to relieve the heart. And if a cough, also depend on X-ray. Some doctor give antivirus medicine, but some give antibiotic. Depends. But in China, still dominates in West medicine. But now Chinese medicine, after that, if the doctor notice the effect not very satisfied, they will give the herbs.
And there is a question: will chrysanthemum?
Chrysanthemum? Chrysanthemum from the TCM, chrysanthemum not good for virus, but good to clean our liver heat. Yeah. If you drink chrysanthemum daily, especially for COVID virus, I don't think this is the effect. Very little. It's like, how about 香商菌冲击？灸冲击，夏桑菊冲剂夏桑菊冲剂 ，that's from the 夏枯草、菊花、桑叶。Okay, if like now in the Indonesian tropical country, we cannot stand hot, right? If in the AC room, but after you sweat, you can also get the AC, then you feel a little bit cold on the body. If in this time, in this moment, you just drink 下桑菊冲剂, also plus the ginger, the effect is best.
And then, do you know what's the best kind of qigong for COVID by experience in Wuhan?
Oh, qigong, yeah. Qigong, there are many. In China, we use a lot of like 八段锦 and also 五禽戏. They're also very well. I think all type of qigong, as long as to boost the qi, like meditation, also good. Also good.
And then, do you have any special suggestion for doctors and nurses to stay safe and healthy while they are on duty, like maybe taking prevention measures?
Oh, you mean our first line, doctor and nurses? Wow. I think the first of all, they must do the best job to prevent infection by themselves. And but actually in China, all of the doctors, nurses, they're not allowed to go back home. They have a special place to make you stay. But I don't know here, Indonesian. But all of like the other hospital, like the other general hospital, they're not special for COVID-19 because the nurse and doctor, they contact with patients every day, but nobody know who is positive, who is negative. But we just do, before you leave home, you have to shower, you have to take a shower and also do the sterilize for your hands and your own clothes, your bag, and even your motorcycle, everything. Make sure it's clean, then back home. And for the healthy meal, still same as us. Don't be so oily, don't be so spicy, to keep our digestion well, drink enough water. This can be worked.
Yeah, I got information that some of the, the nurses and doctors, some of them are provided place to stay after their duty.
Oh, okay, that's good.
Some hospitals.
Yeah.
Okay. Another question from somebody who is sportive here, likes doing sports. So it's the concern is the droplet. Is the droplets include the body fluid from the perspiration, or is it only from coughing, sneezing, or is it any other source of droplets that can cause the transmission?
Yeah. Okay. So far there's no sign of the virus exists in our sweat, also in our the other body fluid, even the milk, sperm, or feces, not much. So if contact with the other thing, the droplet, I think the risk is less, not higher, not as high as from our sneezing, for this membrane, because this is our membrane from sneezing, cough, this place for us to get infected. That's why the virus will stay here for much long. But the other body fluid, I think not much.
Another question is about how about Fu Fang and Jiao to
maintain our immune. Yeah. We use the Fu Fang or Jiao already a long time. This to boost our blood. They also have some Huang Qi inside to boost qi and blood. If we can drink it regularly, okay, good. But inside there's no ingredients to prevent, to kill the virus. No, they only have some ingredient to boost our immune.
Yeah. Related to the inhaling the water steam, one of our participants here, he read some journal that inhaled hot water vapor doesn't have any effect because the vapor cannot enter the lungs. Is it possible by using nebulizer?
Vapor?
Yeah, the water steam.
Steam, this one I don't think, I don't have some research, but in my experience, they're also good for our because if we inhale the hot steam, our membrane will generate a lot of fluid, right? So if generate a lot of fluid, so if we already have stayed some virus like COVID-19, they can get out from our extra the fluid. Basically, theoretically, it's working for us to prevent. I think you deserve to try.
Right. So you are doing the practice in Indonesia, right, Doctor?
Yeah.
So
yeah.
one of our participants here asking whether if we have a friend or colleague who is positive diagnosed COVID, can we recommend our friend, our colleague to get medication to you?
Yeah, no problem. No problem. I have
Okay.
herbs, yeah.
Okay, and then we also got suggestions that we are going outside during the sunrise in the morning between 9, 8 until 10, until 11.
Okay.
To, how to call it, to, yeah. And then what time is recommended? Is it between 7 to 8, 8 to 9, or, yeah, it's a debatable topic here. What time that we should go out for to get the sunshine?
Yeah, so we must get the sunshine, the UV. The UV, the frequency, different time and different, right? Different frequency. People said if from 11 to 12, we just expose 60% of your body and get the sunshine is good for our vitamin D or calcium forming, good for our bone and osteoporosis. But for maintain the health, we need more yang from the sun. I prefer the 7 to 8, 20 to 30 minutes. While we doing the outdoor activity, like jogging, like walking, yeah, you can get the sunshine. It's enough, 30 minutes, enough, from 7 to 8.
In Western education, they use swab and blood tests to determine whether somebody
positive.
is positive. How do you determine in traditional center?
In our TCM, we have no COVID, the viral or bacterial infection. We just see how is the body's, the patient's condition. How is the cough? That's why we have to check individual, the lung, the pulse. Then we decide what type of herbs I will give.
This last question here. Some say that the cold climate also increase the infection possibility, and the warmer temperature and weaken the temperature.
In my point of view, in this time Wuhan's outbreak, just because climate, they're very humid in the air. Also a lot of raindrop. Also, in China, in winter, there are a lot of fog. Also, some cities have smog, a lot of dust float in the air. So this very easy for all type of virus to stay and then infect us. That's why most of us in winter, we look forward the wind and also sun. The sun can evaporate the wet, the humidity, and the wind can blow the dust away. But if in the tropical country like our Indonesian, the sunlight is very strong. But lately I noticed, notice also rain. The air also quite humid, right? So today I see my my thermometer. Normally, just the humidity rate is 40%, but today 65%. So which means today very humid. The humid for us, the low pressure on our breath also not very comfortable.
There is one question here. Lung is metal, so do we have to push more earth?
Yes, okay. This is from a 5 element. Our lungs belong to the metal and our spleen belong to the earth. But our lung generate from earth, which means metal from earth. That's why we mining we mining all of the iron, bronze, copper out from our Earth. Yeah, so that's why if we want to make our lung strong, we must keep our spleen healthy. Healthy is, I mean, spleen belong to Earth, right? But if more metal will produce water element also. Oh no. It's not like this. If this one more, another one more, another one more. No, now this circle moving. Don't worry this.
And then, is it possible that a COVID patient get infected more than one time?
Yes. That's why now this is the biggest problem facing to China. Many people discharge healthily, happily from hospital, but after 1 or 2 weeks, they got positive, they got a cough again. They go back to hospital check, okay, positive again. I honestly say, so far, many professor doctors still not knowing this coronavirus very well. I just read the article. The lymph cell after the patient, for example, the patient discharged healthily from hospital and the patients from positive change to negative. If we take the blood sample, we see the lymph cell, there's difference. Some patients already get positive, already get negative. Their lymph cell is the shape totally different, like claw, like a flower. But for those patients already discharged from hospital with negative, all of that is recovered. Their lymph cell, the shape like irregular shape. But for those irregular shape, they're also easy to get infected again. That's why now still no idea what's going on for this type of virus. They're very tricky. That's why they're very they aim or they attack our immune very bad.
I think there is no more questions in the chat. Shall we open for the direct question about that?
Mm-hmm.
Or maybe Dr. Su, could you please explain again what we can do in order to maintain our health?
All right. Good. Maintain our health. There are many ways. I think many people already know how to maintain health. Yeah. Individually, also depend on our own lifestyle. Like if I like to eat, for example, greasy food, but in this moment try not, like a nasi padang, okay, reduce. Yeah. Or spicy food, okay, reduce. If you drink alcohol, okay, reduce. Smoke, reduce. This is a life, how to keep healthy, right? There's no need to say. Only we have to do. We are a healthy group, people. Better we just don't go out often, frequent. Only this to prevent the self-quarantine. I just advise this, but when can go out still is unknown date. We just pray.
Dr. Su, you mentioned in the beginning that you would like to share your recipe to prevent.
Yeah. Later I will write down in the chat. Yeah. Okay.
Okay, and then another question here. Is the positive COVID patient will show antibody in the
sorry? Antibody? Yeah. Will show antibody. But this antibody, like IgG, IgM, this antibody, although we generate this antibody, the same as the last question, it can be infected again. So same as this antibody to coronavirus, let's say the type A, but next time you got infected by type B. So this type A antibody useless. We have to generate antibody B. But that's why so far the scientists still do the research for this.
It is like dengue, right? There are 4 types.
Yes, yeah, there are many types. But they also, this virus can duplicate. But after they duplicate, maybe change to another type.
Okay.
It's possible that COVID-19 is HIV-like.
Yeah.
It's not attacking lung only, but the regular immune system changed. I think so far this coronavirus 19 still lighter than HIV. HIV, this virus, they accumulate, stay draw in our body for a long time, right? Many years, yeah. But slowly they deprive our immune system. Then, but this corona, I think, is more aggressive for our immune, but directly can working on our lung, can in a short time can make our lung generate a lot of mucus. Compared with HIV, I think this coronavirus, how to say, not if we say the immune system is not as strong as HIV, but it's very fast to risk our life. This is my thinking.
Okay, the last question here. What is your opinion about carimicin?
Carimicin only it produce a research and produce or create in China, in Liaoning province. This carimicin, they say, is very effective to Corona-19. But personally, I don't think this is very. I have no much comment for this carimicin. So I will do some more research for this carimicin. But in China, also very hard to get this medicine. Many people ask me, can you get this? Sorry, I don't know where.
Okay, doctor. I think we need to end the question and answer session so that we can give you time in order to share us the prescription that you mentioned. So, well, thank you so much for the presentation and your answers.
Oh, you're welcome.
And also, please, we will wait for you to share your prescription.
Okay.
So I will return the floor to our MC.
Okay.
Okay. Thank you, Dr. Su. Thank you for your time. Thank you for your enlightenment to us. I believe your presentation will be very useful for all of us.
I hope so too.
Oke. Thank you juga buat Frida yang sudah meluangkan waktunya untuk mau memoderatorin acara ini. Permintaan maaf dari Yosep Erik selaku Ketua BPK KEKL Jakarta karena lampu di Semarang lagi mati sehingga beliau tidak bisa untuk closing di sini. Ini mungkin acara kita yang dengan KEKL yang kedua. Minggu depan IATS akan bergabung dengan IATI di jam yang sama untuk bicara mengenai topik yang berbeda tapi masih dalam kaitannya mengenai COVID ini, yaitu kita akan bicara mengenai ekonomi. Dan kebetulan juga pembicaranya juga sama nanti dengan KEKL, cuman KEKL nanti jam 4, kita IATS dengan IATI jam 6 sore. Tadi saya juga sempat minta ketua IATI yang juga bergabung di sini tapi belum mau bicara, katanya minggu depan aja. Mungkin dari saya cukup sekian. Satu hal lagi mungkin sebelum kelupaan, IATS sampai saat ini masih membuka donasi yang akan kita bagikan untuk untuk korban-korban COVID ini. Jadi kalau misalnya ada yang tergerak untuk memberikan sumbangan, tentunya akan sangat berguna sekali buat kita. Dan saya rasa KEKL juga punya program yang sama, tapi nanti rekeningnya masing-masing. Sekian dari saya, terima kasih semuanya. Sebelum akhiri mungkin nanti kita foto bersama ya.
Yuk, Bro Andreas, sorry, Dr. Su belum selesai nulis itunya, type
ini.
Oh,
oke.
Thank you. Let me finish this prescription.
I see.
Yeah.
Mungkin sambil nunggu Dr. Su, kita foto bareng dulu, Bro Dan.
Oke,
teman-teman mungkin bisa nyalain videonya. Kameranya bisa dinyalakan semua sehingga kita bisa ambil foto sama-sama.
Oke. Saya tutup dulu ya ininya. Oke.
Dan yang capture?
Ya, oke. Satu. Ada 3 screen. Ada 3 screen. Yang screen kedua boleh tolong dinyalakan. Bentar ya.
Screen kedua masih banyak yang off.
Ya, screen kedua masih banyak yang off. Nah, ini udah mulai pada nyala. Oke, screen kedua. Screen kedua masih banyak yang ini. Screen ketiga juga boleh tolong dinyalakan videonya. Oke, nah ini mulai nyala. Ya, screen kedua dulu deh. Screen kedua dulu. Oke, masih ada berapa yang belum? Sebentar. Yang ini yang ketiga. Yang ketiga, boleh tolong dinyalakan. Ya. Oke, masih nggak apa-apa. Masih ada beberapa yang nggak begitu kelihatan sih tadi. Oke, ini yang pertama. Oke. Oke. Sekarang tunggu lagi dari ini. Nah, ini ada dari Dr. Su ada resep.
Ya. Okay, the acupuncture and the herbs are already sent. Another important message is to try to drink warm water every day. Yeah, by Arif. Yeah.
Yeah.
The herbs is on top. This is prescription. Yeah. But I write down the pinyin. If you show this prescription to the Toko Opat, I think they all know what is this. But if someone needs the specific herbs, please contact with me. I also send email. Also, sorry, email. Yeah. Okay.
Okay. Okay.
Yes. One take. Okay. Okay. Thank you so much, everybody.
Yeah. Yeah.
Okay.
Okay. Bro Hendrik, ada ini tambahan mungkin?
Cukup. Lapar ini mau makan.
Oke.
Ya, thank you.
Oke.
Thank you.
Ya.
Sudah difoto, Bro Dan?
Sudah.
Sudah.
Masih ada beberapa yang belum nggak kelihatan mukanya, tapi nggak apa-apa. Sudah saya foto semuanya.
Oke, bye-bye Frida.
Sip.
Halo.
Bye-bye, Frida.
Ya.
Thank
Oke,
you.
terima kasih semuanya.
Thank you, Pak Andreas.
Thank
Thank
you very
you,
much.
Pak Daniel.
Ya. Thank you, Dr. Su.
Bye, Hendrik. Bye.
Ya, oke.
Terima kasih semuanya, teman-teman IATS maupun KEKL. Juga ada beberapa dari IK Unpar.
Ya, oke, thank you. Chatnya saya matikan.